In this video, I will tell you how to identify the muscles of the anterior aspect of the forearm. You see, there are no intermuscular septa present in the forearm, so few muscles of the back of the forearm are also seen from the front of the forearm. So these are the ones which come from the lateral aspect. This is the picture of a right forearm, and as you can see, three muscles of the posterior aspect of forearm, the brachioradialis, extensor carpi radialis longus and extensor carpi radialis brevis, can also be seen in the front of the forearm. So we'll keep these three muscles aside. Now, talking about the muscles of the anterior aspect of the forearm, you know there are 8 muscles, 5 superficial and 3 deep. Of the 5 superficial, 4 muscles you find in the superficial most plane. All these muscles, these 4 muscles, they arise as common, they take common origin from the medial epicondyle. So you can see Pronator teres, which also forms the boundary of the cubital fossa. Flexure carpi radialis, which you will see will be going towards the lateral aspect of the wrist. Third will be the palmaris longus, which becomes palmar aponeurosis in the wrist, in the hand. And you will see the medial most one, the flexure carpi ulnaris. This will go along the medial border of the forearm up to the medial aspect of the hand. Now you see how you identify these tendons, these muscles. They are tendinous in the lower aspect, but they are muscular above. So always when you are looking for the white tendons near the wrist, go and trace them above to see whether they are muscles or not. If it is a muscle, then definitely the white tendons will continue above in the muscles. Now you see, in between these 4 tendons, you will be able to find some other white structures. Now you have to make sure that they are the tendons of flexure digitorum superficialis. How will you confirm? You will go to the hand and you will get hold of any of the tendons and try to pull it. So if it is the flexure digitorum superficialis, you will know by its continuity. In the dissected body, you do not see this continuity. You find flexure retinaculum in this position where I have kept this pen. Now, what about the 3 deeper muscles? The 3 deeper muscles are Pronator Quadratus, which you will find lying horizontally. If you just push these tendons to one side, and just above, then you will find medially the tendon which you will find will be the flexure digitorum profundus, and laterally the one you will find after retracting the superficial ones, that will be the flexure pollicis longus going to the thumb pollis. Now about the nerves. Among these tendons only, you will find in a deeper plane a nerve. So that will be again white and glistening like this. How will you differentiate? You will trace it above and down, and you will see that it doesn't continue in muscle fibers. So that will be the median nerve in this position. You will find another nerve under cover of this medial most muscle, the flexure carpi ulnaris, and medial to this nerve you will find an artery accompanied by the vena comitatus. The artery will be the ulnar artery. So ulnar nerve lies medial to the ulnar artery. Similarly, beneath the brachioradialis on the lateral aspect, you will find another pair of nerve and artery. The nerve lying lateral and artery medially. The artery is the radial artery, and it is again accompanied by the vena commodentis, and lateral to it the nerve will be the superficial division of the radial artery. So it is only the superficial division of the radial nerve, right? So you can see the superficial division of radial nerve and the ulnar nerve, they lie on the outer aspect of the respective arteries.